did you find it this morning?
Good.
Yeah, not bad. Thank you for letting me know. There was it said AM, that's why you couldn't upload it earlier instead of PM.
Okay.
That's what it was.
Yeah, I got it on there now.
Yeah. There's always something to do. So I thought we would do, first of all, did all of you finish the assignment from this morning or not yet?
Yeah, I finished.
I noticed a couple of you have already finished everything and uploaded. Elisa, have you? Did you finish it all? Did you do your, you did your concept map?
No, wait, I don't think so. I think that's what I'm missing out of it.
Yeah, there's a couple of you that I didn't see concept maps. Let me see.
I need to put it there.
Let me see. Bear with me. Yeah, Elisa, I didn't see a concept map for you. All I saw is a Word doc answering the questions, and I didn't see your uploads for your skills yet. But, you know, you've got time to get that done. I wonder who's on. 1, 2, 3, 4 of you. I'm still waiting for 2 others. Kaylin, I don't see anything from you yet submitted.
What about me, Professor? What about me?
Who's me?
Mimi.
Mimi. I think I already saw you. Yeah, I already. You did graded yours.
Awesome.
Yep.
Thank you.
Thank you. So yeah, Lisa. Yeah, Lisa, you need your concept map and your skill. Looks like Rhonda's not on. Yeah, Amber, I don't see your submission yet, but you got time. Evelyn, you did great too. I've already graded yours. Okay. All right. So, well, first of all, how did you find that? I'm hoping Rhonda's going to join us. Can somebody let Rhonda know? I texted her, but I'm sorry I've had to make this at 12 instead of 1. It's a little awkward with the 5-hour time difference, and there's going to be like a FaceTime conference call at 6 p.m. British time with my family with hospice, so I don't really have a choice. I can't tell them to, you know, I sort of had to change the time, so I apologize for that. How did you find this case study, looking at this Miss Yeo?
You didn't give us enough information, but you know.
It was confusing.
I enjoyed it.
It's confusing.
It was because it jumps from one spot to the next and then to another one. It was like trying to.
Houseway.
I couldn't focus, but I figured out, tried to make it fit where it would.
Okay, so Miss Yu, she's transferred from the PACU to MedSurg. Yeah. She had an appendectomy. She had an IV. What information should the PACU nurse give to the MedSurg nurse? What did that make sense?
It wasn't that difficult. You report what happened during the surgery. She got an IV with a hanging, you know, anchored cath or whatever. You make sure that her temperature is good. Like you know, give her issue. Was she stable upon leaving the OR? She was stable, in stable condition. Her vital signs were. The site was dressed and this, that, and the third. You know what I'm saying? You just tell what happened. It's not
report. You give report. I mean, you're gonna give information about anything that was unexpected as well.
Right.
Yeah.
Did she? When the last time she had pain medication?
Yeah. I mean, so on chapter 16, for instance, and I'm looking at it right now, gives you a very beautiful assessment of what you're looking at for your post-op patient, right? For instance, the post-anesthesia recovery score. And actually, we'll talk a little bit more about this tomorrow, but in chapter 3, just to let you know, I'm looking for the page for you. Just did it a minute ago. There is basically, it's called the RAS, the recovery scores, and there's many, many different ways that you can look at it, but basically there's different scoring systems to evaluate how your patient is doing. And that includes, of course, their respiratory rate, their circulation, their consciousness, their saturation, their ability to move, all of those components you're going to look at. So this is the type of information that the PACU nurse would be giving to the med-surg nurse. You know, how is that patient doing? How much, what their INOs are doing, intake, you know, IV fluids, what their urine output is, right? We want to know whether they're having any retention, all of those types of things. Neurologically, are they answering to their name? Now, one of the things that you may want to be aware of is when somebody's coming out of surgery or in any situation, would you say, could you tell me your name? Or would you say, hey, Mr. Jones, what's your name? I'm just curious. This is not a trick question particularly. I'm just trying to.
You ask them what their name is.
Thank you. Ask them what their name is. Remember, if somebody's confused, the reason I bring this up is because if you're working in an environment, say, where people don't have name bands, and they may be confused, or they may have moved rooms or something of that nature, and you turn around and say, oh, are you Mr. Jones? And they might go, yes. And you're like, oh, okay, here's your meds, right? Huge no. So you're going to actually say to them, tell me your name. Tell me your name. Tell me your date of birth. Those basic things, just to get an idea as to what their baseline is. Now, you know, if they're confused, they're confused. But it's just one of those things that you want to do is actually ask them their name, not you tell them their name and then they go yes or no. All right. So open-ended questions are always going to be a good choice for you. The scale, by the way, that I'm talking about is chapter 15, and it is on page 262. And there's just a few different scales that they bullet point there that you use to assess, and different hospitals use different ones. But I did want you to be aware of that. And then on page 273, there's a nice little post-anesthesia care record. And at the top, there's a recovery score component there. So anyway, all right. So number 1 talks about what information you're going to give to the nurse that you're handing over to. So that's, I think, fairly straightforward. All right. So Mrs. Yeo is transferred to the unit bed. Family is waiting for her. What priority assessments should the med-surg nurse make when Miss Yeo arrives on the floor? So what do you think you're looking for?
She need to check the temperature. She need to check for the drainage.
I think there's an echo. Might be. Let me put myself on mute.
Can you hear me? It's still an echo, but because the 2 others are not on. The temperature should be checked, because that's the sign. You know, when she has an elevated temp, that might be a sign of infection. So check her temperature immediately. Go ahead and check the site and make sure that there's like the drainage is that it's supposed to be, like, and make sure it's not. I guess I want to say like you're gonna see blood, but if you see like, I guess, green or yellow and stuff like that already, then that means it's infected and stuff. So check the site and make sure that the dressing is intact, in place, and secure. And then you can check her mental status and see how she's doing.
And you're also going to want to check her IV and catheter just so it's not infiltrated or anything.
Yeah. You're on mute.
I muted myself on purpose because so I didn't get your echo. Of course, chapter 16 talks about all of the pieces that you're going to do, the respiratory system, right? Even if she is awake, there are certain things that we are going to do as that nurse taking that patient. We will have looked at her history. Is she a smoker? Does she have comorbidities, asthma, COPD, anything that could inhibit her from taking nice deep breaths and using what? What type of little device could be used to help with breathing? Any idea?
A what's it called? A spear monitoring?
Incentive spirometer. Incentive spirometer. Yeah. And actually, I want to say chapter 14. Let's see if I can find. Yeah. Chapter 14 on page 244 has a picture of somebody using an incentive spirometer. And, we may have already hopefully done some teaching pre-op to help that patient understand what an incentive spirometer is. But we're going to help the patient to, really take some good deep breaths every hour, right? We want them to start doing that hourly, taking those breaths. Making sure they do splinting, right, when they're coughing on the whole. She's just had an appendectomy, so we don't want a wound to what? What could that wound do if they're coughing?
Open back up with this.
Yeah, dehiscence, right? Or she could get a hernia. So we want to protect that and teach her how to splint that area if she's coughing, those types of things, right? So yes, you're going to check her cognitive status, her respiratory status. Of course, you're going to check her cardiovascular status, right? Your vital signs. You're going to check her heart sounds. It doesn't say what she's young, but again, she may be on birth control pills, right? She's only, I think, 25. So that could be a risk, couldn't it? 25-year-old female. Post-surgery, what could that cause a risk for?
What's it called? Emotional stuff. Like she gonna be like, oh my God, I got a scar. Oh my God. So
well, I'm thinking more physiology right now, with birth control pills. What's a big risk?
my bad.
Sorry, what's a big risk? Any idea? Blood clots, right? DVTs, those types of things. So, somebody 25-year-old, I might be thinking, she's on birth control pills, want to make sure she's not developing a clot. Yeah? DVT, that type of thing that could lead to what? APE, clot in the lungs. So we want to monitor those types of things. Just because she's 25, we don't know. You want to check that blood pressure, right? Make sure there's nothing going on there as well. Make sure it's not dropping for some reason, that she's not having some going into shock. She's had an appendectomy. She could have a risk for bleeding, all of those types of things. So there's a ton of stuff that you're going to assess with that patient when she comes to your floor, even after surgery. And just understanding as well her health history. So let's see what members of the interprofessional healthcare team may collaborate to care while she is hospitalized. Well, give me some clues. Have any of you been in the hospital? What do you think? You're working as a team, you're not doing everything yourself, right? So give me some ideas of what the team might be doing, what her needs might be.
I think I understand your question. You mean like, okay, so I'm gonna have the nursing assistant take the vitals. I'm gonna have the nutrition people come and see what new diet she needs to have. Or if any.
It could be respiratory. It could be PTOT. Get her up, get her moving. It could be respiratory therapy. These are not trick questions. This is just to get you thinking, right? It's not about, she may need a case manager. We don't know. We may, maybe that she's got to be discharged with home health care, those types of things. So there's a lot of interprofessional team that what you see them rounding, right? I don't know, do any of you work actually in the hospital environments where you may see them rounding as a team, and you'll have your physicians, you'll have your nurses, you'll have your dietitian, you'll have your pharmacist, you'll have your respiratory, you'll have your therapy team, you'll have your case manager. They work as
Yeah, it's
a
called a
team.
huddle.
Yeah.
Well,
To
we can do
help
that in a nursing home too.
transition that patient. All right, all of those things. So, that just helps with all of it, helping to get her the throughput done more efficiently, rather than the fragmented care that you will see if you ever have to deal with the NHS. That's all I have to say about that. All right, so this patient, Miss Yeo, is to be discharged on the second post-operative day. What information is important for the nurse to provide? Well, okay, you're the nurse looking after this patient. What type of thing do you think, what information are you going to give to that patient? She's young, she's had an appendectomy. What do you think?
I'm gonna teach her how to properly clean her wound. Teach her on the drug adverse effects that the drugs will have on her. Obviously, she can't like jump around right after surgery, so a list of activities that she can do, and also schedule a follow-up appointment with the surgeon as well. All those follow-up appointments that happen.
Yeah. Absolutely. And do you think it's a good idea, if this patient has a dressing, what do we tend to just say, I'm going to show you how to do this dressing and bye?
No, you want her to demonstrate for you, so
Thank
know
you.
that she can do it.
Right, return demonstration. That's really going to help you know that she knows what she's doing, right? And that's going to include things like washing your hands, right? Putting your gloves on, making sure you put the cream on properly, or whatever it is she's got to put on. There might be an antiseptic cream or something that she has to put on, and making sure she does that properly as well, that she's getting it and putting it on the wound, and that she's going to do those types of things appropriately, making sure she knows how to throw dressings away as well, that whole process, making sure that she knows what to look for signs and symptoms of infection, and who to call if she has any questions or concerns or anything like that. So does that help you a little bit more, Elisa, with what that meant?
It helps.
A little bit?
Yeah.
Yeah. So from the perspective of the concept map, you're going to use whatever you felt is the most important piece of it to develop a concept map. And it could be the wound itself, it could be the respiratory component, it could be the cardiovascular component. What else are we looking for when a patient is post-op? We mentioned neuro, we mentioned respiratory, we mentioned cardiovascular. What about GI? What about her gut? We've just done something on her gut, right? So is she going to be eating and drinking straight away, do you think? Maybe not. Yeah. You got to wait. You got to check bowel sounds, right? Got to auscultate, listen for bowel sounds, make sure that that she doesn't have some issues with the GI system, like an ileus. That could be an issue. Yeah. Got to make sure that she may have had post-op nausea and vomiting, but that then resolves, so that we can make sure that she can eat if she's allowed to. Make sure that we're going to give her, we're probably not going to start out with a sandwich, right? We're going to start out with maybe clear fluids, see how she goes with that. Then maybe go to full liquids, see how she goes with that. Before we go to, you know, a full meal, those types of things, right? So there's all of those pieces that we're going to look for, right? Some people as well respond really badly to medications. Yeah. So we may have given her something for post-op pain and she develops a reaction to that. So there's a lot of different pieces, even with an appendectomy, that we have to be really, really cautious about. Let's see, what about urinary voiding? One of the big issues with post-op patients can be what? Any idea?
She needed a stool softener because if she has any bowels, if she's getting ready to have a bowel movement, it needs to be smooth sailing. She doesn't need any type of strain or discomfort in that area. So a stool softener.
Mm-hmm. Because opioids can do what?
Constipate you.
Yeah, they reduce peristalsis. So that's one piece of it. But also, I'm also thinking about urinary. A lot of time these medications that you're using pre-op and post-operatively can also cause, you know, retention, right? Urinary retention. So we're watching that urine output. We want it to be at least what? What does she need
30.
to be voiding?
Did you say 30 before?
30 cc's an hour. Yep. Yeah. So anything less than that, we're going to be a little bit concerned. All right. So there's a lot of different pieces that we're going to be looking at, even for a simple surgery that somebody comes in and is discharged within a couple of days. A lot can go wrong in just a very simple surgery like this. So just be aware of those types of things. Does that help a little bit more with where you're going with that? And as I say, we're going to dig in a little bit more tomorrow, but I just thought this would be a nice teaser for you to get you thinking. I don't know if anybody wants to work in pre or post-op or op, you know, the operative world, but if you do, then, and even if you're not going to, if you're working on a med-surg floor, then you're definitely going to be aware of all of these types of things going on. All right. So that is what I wanted to talk about on there. Now, let me, before I move on to dosage calc, which I have a few questions for you on the dosage calc. Let's see. Your Silvestri books this week is chapter 18 and 46, FYI. I really suggest you look at these Silvestri books and read them. I'm just going to go over some of the questions for the NCLEX questions from chapter 18. Chapter 46, just FYI, talks a lot about burns. And so although I'm not doing a burns question and answer, and as I say, I didn't see any burns questions come up on the last HESI, I do suggest you read about burns. Okay. All right. So without further ado, I've got some questions for you. The nurses have reassessed the condition of a post-op client who was admitted 1 hour ago to the surgical unit. The nurse plans to monitor which parameter most carefully during the next hour. 1, urinary output of 20 cc's an hour. 2, temperature of 37.6. Blood 100/70. Or serous drainage on the surgical dressing. What's the most important thing you're assessing? I just talked about it.
The urine output.
Yes. Anyone with a urine output of 20 cc's an hour is a concern, right? Just talked about that. All right, what about this one? The nurse is teaching a client about coughing and deep breathing to prevent post-op complications. Which is most appropriate for the nurse to make to the client at this time as it relates to these techniques? We're talking about deep breathing post-op. Use of incentive spirometer will help prevent pneumonia. Close monitoring of your oxygen saturation will detect hypoxemia. Administration of IV fluids will prevent or treat fluid imbalance. Early ambulation and administration of blood thinners will prevent a pulmonary embolism. We're talking about deep breathing techniques. What do you think the most appropriate discussion is?
I would think the early ambulation, right?
Anybody else?
The first one.
The spirometer.
Incentive spirometer. Yep. Yep. The use of an incentive spirometer will help prevent pneumonia. All right. Couple more. Actually, let's do this one. I'm going to test you on your lab values. A client who has undergone pre-admission testing has blood drawn. What lab value should be reported to the surgeon's office by the nurse, knowing it could cause surgery to be postponed? 1, a hemoglobin of 8. 2, sodium of 145. 3, serum creatinine of 0.8. 4, platelets of 21,000. Oh, what one do you think? You'd want
Hemoglobin.
that surgeon. Pardon?
Hemoglobin is only at 8.
Yes. Yeah. A low hemoglobin. You know, you don't want to cause more, we're going to cause more blood loss, right? When they have surgery. All right. One more, actually 2 more. And the reason I'm asking these is because I've seen this type of thing show up on HESs and things. So, patient is scheduled for surgery. The client cannot sign the op report. The operative consent form because of sedation from opioid analgesics that have been administered. The nurse should take which most appropriate action in the care of this client? 1, obtain a court order for surgery. 2, have the charge nurse sign the informed consent immediately. 3, send the client to surgery without the consent form being signed. Lisa's face. 4, obtain a telephone consent from family member following an agency policy.
The last one.
The last one, yes. All right, one more, and then we'll move on. A pre-op client expresses anxiety about they're going to have some surgery. Which response by the nurse is most likely to stimulate further discussion between the client and the nurse? If it's any help, everybody's nervous before surgery. That's 1. 2, I will be happy to explain the entire surgical procedure to you. 2. 3, can you share with me what you've been told about your surgery? Or 4, let me tell you about the care you'll receive after surgery and the amount of pain that you can anticipate.
3.
3. Yeah. All right. So, you know, in these types of questions, what are you doing here on that question? What are you trying to find out on that one?
What's going on
Baseline.
with them?
Yeah.
Yeah, what they understand about it. And remember, it's not our responsibility to explain the whole surgery procedure to the patient. Whose responsibility is that? Thank you. Yep. It's our responsibility to make sure that they understand the surgeon, what the surgeon was talking about, but it's up to the surgeon to really talk about all of that piece of it, okay? And then we, of course, advocate in the ways that we're supposed to do as well. And all right. I listened to you guys. You said you wanted to do things like this. You know, I did look at Join My Quiz, trying to find a few decent Join My Quiz ones, and they're all a bit cheesy when it came to this stuff, quite frankly. I couldn't find a good one. So I still might do a cheesy one anyway, just for the heck of it. So let's move on. Let me share freehand.
Professor, real quick, is what in this book are we supposed to be looking at, or all of it?
What do you mean?
You kept saying go to the clinical companion. So what are we?
Oh, you mean for week 3 for clinical companion? In your clinical companion on week 3, it is inflammation, infection, pain, and perioperative care. Now, remember, I don't grade those pieces. That's you know, that's homework for you to look at. Do you all have that little book that Mimi's got in her hand? Can you see that?
No.
Did you not order your fundamentals? It's a funds book.
No, I didn't get the little clinical handbook. I just got the funds book when I went my go around. So I don't know.
Okay. I don't know if you can access it on the ebook. You may want to try and see if you can access that on the ebook. So on Canvas, I've put it on ebook. So you may want to see if you can download that. All right, let's do seeing as though this week 3 we're going to have an exam. I do want to go over a few questions. So let's see. Let's start with a drops per minute one, right? Should we start with that? I know how much you all love drops per minute. So, all right, this is a drops per minute one. Give me a second. Okay, drops per minute. So this patient has, let's see, he's got an IV infusion, and it's 1,000 mils at 750 mils in 4 hours. And the drop, the IV set, delivers 60 drops per mil. So what we want to know is how many drops per minute. How many drops per minute? So let's look at this. What's our first pair if we're looking at drops per minute?
60 GTT over 1 milliliter.
You can do it that way if you want to. You want to. So let's see. And then I have to, oops, sorry guys, I apologize. Multiplied by what?
750 milliliters over 4 hours.
Sorry guys, how can I can't move this thing on. Ah! What am I doing wrong? Can anyone move that on? Okay, that's not going to work. Try it, Amber. See if it will.
Oh. No, sometimes it's so tricky.
Isn't
That's
it?
literally
It's a
what is
pain in the
happening.
butt. Yeah.
Yeah.
All right, let me try something else. All right, let me try. So, what did you say? 750?
Yeah.
Oh, golly. Okay, 750 mils over 4 hours. Do we want hours or do we want minutes?
Minutes.
So what would be next?
1 hour over 60 minutes.
Sorry, guys. All right, and so we've got the drips. Where did our, okay, here's our, yeah. Okay, so let me just look at this a second. So we've got 60, so let's see. Do me a favor, multiply the top, please.
45,000.
Mm-hmm. Yeah, this thing is, there has to be a better way. It's just very time consuming otherwise. And what would be on the bottom?
240.
Mm-hmm. Come out to. What's that come out to?
187.5, but then rounded up to 188.
You got it. Oops. Drops. You get the idea, right? Per minute. All right. Get rid of that. You know, I'm sure there used to be a thing here that said delete. Because I shouldn't have to just... oh.
In your
Here we
three
go, I got
dots,
you.
export
I got
image.
you.
What did you do?
I go up to the pointer right above the pencil.
Up here? Okay.
Right over here.
Oh, over here. Oh, the
Yeah, where you
erase.
can like text whenever, and then you get
Yes,
the
the
pointer
eraser.
and just
Yep. I
go
want to
no.
say, I don't know if it, I thought the eraser used to be somewhere else, but anyway. All right, so do you have an idea what you're doing with the drops per minute? I know we did a few last week. So let's do mils per hour one. And then I want to do about 3 of the microgram per kilogram per minute type of one and build on that. So let me look for a mils per hour. Okay, all right. Let me do a mils per hour one. All right. So mils per hour. So this one is, let me see what it says here. It's an IV of, I don't know if I need to put all of this in. Yep, 0.5 grams of Wotrex and 250 mils. So this is an IV, and I'll just put 250 mils of normal saline. It's going at a rate of 1200 micrograms per minute. But what we want to know is how, I'm going to put here, rate basically, we're looking for mils per hour, all right? So where are you going to start with this one? We know we want mils per hour. Is that all I can do with that?
Where it says 0.5
Grams.
grams. Okay, perfect. Oh yeah, so you're just gonna want to change that into micrograms.
Yes, we do want to change that into micrograms. We have to, right? So let's look at this a little bit. So first of all, how many micrograms are in a gram? You got to do that. We've got to convert it. So you could do it like this, right? 1 gram. Oops. Oh, sorry, guys. I wish it was a little simpler. 1 gram. How many micrograms? Not milligrams. How many micrograms? I'm going to start the zeros. Is it 1,000 or is it more than 1,000? How many micrograms in a gram?
Micrograms in a gram.
1,000.
And
Keep going.
1 gram. Oh, 2,000. Right? No.
A million.
A million.
I'm guessing.
Okay. So this is why I want you to learn these pieces, because, you know, you're not going to have that much time, right? So just know it. If it was a milligram, you would be right with 1,000, but it's a microgram. So we're looking at micrograms. So what would go across for your microgram?
1,200 micrograms.
Mm-hmm.
I don't understand why that 1 gram went up top, but okay, I'll play.
Well, I'm helping you to break it down. You know how you do your minutes per hour type of thing, and you put your 60 minutes in there? Same concept. Unless you want to do it off the top of your head, and you can. But, you know, if you can't, then you're going to have to put this in here. Sorry, that's microgram in 1 minute, right? Do we want minutes?
No, we want
No.
hours.
Okay.
So 60 over 1 or 1 over 60?
Yeah. So, and there's one piece there is here that we still don't have. Okay.
That's
And I would have to put it up here, actually. It would have been your first pair. Over here.
oh, the ml
I-
is 250.
Yeah,
Mhm.
with your gram. So if you don't mind, so mils would go on the top, right? So I'm just going to squeeze it in here. 250 mils. Just ignore, sorry. And what would go on the bottom here?
0.5, right?
Mm-hmm. And if you want, let me rewrite this out. let me write all this out. Oh, that won't. All right. Come on. Oh, God. Sorry. We know we want. Well, anyway, we know. Do you want me to? I'll write it back out for you again. I'm so sorry. We've got 250 mils in 0.5 grams. What else do we have? We have the rate, 1200 micrograms a minute. And we want mils per. So we already established that we're looking at mils per hour. I'm going to have to do it like this, I'm afraid. So our first pair is this one. Let's put this in. And we established that we don't really want grams, right? We're looking at micrograms. So now you would do your, in order to get rid of your grams, you're going to do this. And we now know how many micrograms are in a gram.
1,000,000.
1,000,000. 2, 3, 4, 5, 6. I'm sorry. If anybody can do better than me, please help me out here. So what am I going to put on the top here? The 1200, right?
Mm-hmm. Over 1 minute.
Mm-hmm. Sorry. And then in order to cancel this out, now 60 minutes. Over 1 hour. Oof. All right. Anybody got that yet? What is it? How many mils per hour would that be?
I got 18.
Well, you know what? It's 18 million on the top
Mm-hmm.
and 500,000 on the bottom.
Never mind. I did not get 18. I wrote the 0.5 grams really tiny. I totally forgot about it. Let me go back. Uh, 36.
Good job. 36 mils per hour. Aren't we grateful that we have pumps that do a lot of this for us nowadays? Even so. But the reason I brought this one out is, you know, I don't think I'm going to give you anything as complicated as that in the exam. I'll check, but I really wanted you to see this one for the purposes of the fact that we've got this microgram here and here. And I don't think you're going to see a lot of that type of thing, but I really wanted to bring that out because, you know, it's good to know that off the top of your head. You can just sort of drill it down. And if you don't know it, at least you now know how many micrograms are in a gram, right? And you'll remember that. So let's do another one. Let's do one of these micrograms, kilogram per minute type of deal. On the whole, you know, the mils per hour is going to be a straightforward one for you. But as I say, I just wanted to, the reason I brought that one out is because of the differences in the grams and micrograms and things like that. And I just wanted you to really be aware of that. This could be milligrams, right? In which case this would be 1,000 under here. Yeah, that makes sense.
Yep.
Okay.
Yeah.
All right. All right. Well, you know what? That's still not working for me. Come on. Should get rid of all of it at once, no?
There we go.
What did you do to get rid of all of it at once?
You go to the pointer
Yeah.
and then you just
Click
click over all of it and then press the backspace button.
All right. I'll try that next time. Okay, who wants to do a bit of drawing? Me? Anybody? Me? Evelyn? Rhonda? Taylor?
I don't touch the whiteboard. I screw it up every time.
Elisa? Anybody? Rhonda's. All right. So we're going to look at a microgram per kilogram per minute question. And, you know, if you end up working in the ICU, even on the floor, some of the telemetry units, you may see dopamine infusions. Okay. So I would say dopamine is, I'm going to do a couple of dopamine ones because that's potentially the one that you're going to see a lot of. So this is a dopamine infusion. And let me see if I can just put it here. Dopamine. Oops. Dopamine. And the dopamine is going to go at 12 mils per hour. You always look at the weight. The weight on this patient is going to be, 70 kilograms. And remember, they might put it in pounds, right? So if it's in pounds, you're going to have to convert it to kilograms. Yeah? Just FYI. But I'm making it easier for you today. And then the concentration. 1 second, I just. Okay. Concentration of. I have very needy friends who think because I'm a nurse practitioner, they can send me pictures and the other all the time. What is this? I've got this bruise here. I've got this. Oh my goodness. Telemedicine for free.
Hey.
All right. Dopamine is 800 milligrams in 250 mils. Or I won't hear from one of them for, you know, a year, and then they'll go, hi, and they'll call me because they need something. All right. So that's what you've got. And I'm paraphrasing a little bit with this question, but this is basically what you're going to be looking for in the question. So the dopamine is 12 mils per hour. The patient weighs X amount. In this case, it's going to be 70 kilograms. And they're always going to give you the concentration of the medication. In this case, it's 80 milligrams in 250 mils. All right, that's the bag. So it's 250 mils and it's got 800 milligrams of dopamine in it. So we're going to calculate micrograms per kilogram per minute. So let's look at this. First of all, we want to know how to write this out. So I would put micrograms kilogram per minute equals, and then I'm going to go over to this. So first thing, what is our first pair that you've got here? Oh, I keep doing that. What's our first pair?
the 800 with the
Mhm.
250.
Oh,
Yeah.
But
Yeah, you already saw it, right? This.
Okay.
Yeah. That's exactly why we're doing it. All right, so it's
I missed it.
800. It's 800 milligrams in 250 mils. Well, that's great. But do we want milligrams?
No, we want MCGs.
All right. So let's put our 1 milligram, whoops, here to pair that out. What are you going to put on the top?
1,000.
Yeah. Is that your favorite color, Mimi?
Nope, it is not.
Put
There's no-
micrograms there, please, so that we know what we.
You said put what?
Yes, please.
MLs.
MCG.
I'm no better than you.
It's
It's readable.
Yeah, much readable than mine. Okay, so put a multiplication sign, please. All right. So, what else have we got going on there? What other pair do we have that would work?
12 mLs an hour.
Yeah. Mm-hmm. Okay. Can get that.
Is that wrong?
No, you're right. And what else needs to go down there?
2.2 right here.
Hang on. Well, you can if you can do that. No, well, no, you don't need to, Mimi, because we're already at
I
micrograms.
can't hear.
We already have micrograms. So here you're going to put on the top. Remember, we're looking at micrograms per minute. So how many minutes? 60.
So take away that kilogram, right?
No, this is a combo right here. Leave that together. But on the top, we want minutes, not hours. So we've still got to put 60 there in order to get us down to 1. I'm
I
going to put
disappeared.
an hour on the top. Because we've got to cancel this out, right? So 70 kilograms for 60 minutes. And then, actually, and remember, we're not after mils. That's not what we're looking for right now. We're looking for, what are we actually looking for? Micrograms, which is on the top, per kilogram per minute on the bottom. That's what we're looking for. So what would this top number be? 800 multiplied by 1,000 multiplied by 12.
Oh, okay, hold on. Am I in this by myself? I said, am I in this by myself? Like nobody is saying anything.
Sorry, guys.
96.
My mom rushing my stepdad to the hospital.
Oh no.
Oh, you better go, Amber.
No, she said she's gonna keep me posted, because there's only one person allowed in the hospital.
Oh,
But
yeah.
yeah.
Is he okay? What? Wow. Okay. Are you all right? Do you need to leave?
No, I'm okay.
You okay?
Yeah.
All right. Okay.
It's
So,
9,600,000.
No,
Yeah.
nine.
mm-mm. Type. So it's 9, 6,
I wrote it
0. Where?
right there.
310.
Where?
You can't see it?
Uh-uh.
Okay. Nobody can see it?
I can see it.
You can see. I can't see it.
I'll
So,
erase
what color did you use?
it. Green. If y'all minimize your zoom out, then you can see it. But it's cool. I don't know how to take it out. I
All
erased
right. Well, we've got to put a few more. We've got to put a few more zeros in here, right? What's the bottom number? 250 by 60 by 70. What have we got there?
17,500.
So maybe I've done something wrong here. Because I've got. Hang on, let me just get out. I can't get this out the way. What did
Professor, you have to go.
bottom number?
I can't do it. No.
It should be. Wow, what have we got going on here? That's not what I've got. I've got 1050 and then 000.
Right. That's what I got.
Okay. Who said that's what they got?
Evelyn.
Okay, that's what I got too. So what I actually got was 1050. Sorry. Oh. So I tend to make things easier. I tend to do that to clear the space because you don't need all those zeros. So 9,600 divided by 1050. What would that be?
Oh my gosh.
9.14, but it would be 9, right?
Well, it's 9.1. It's 9.1 is what I got. I didn't give you instructions as to whether you would round up or round down. So if they don't say rounding in the question, then just leave it.
Okay.
Okay. So these are a little tricky. These ones, they're easy at all. So let's do
It's 1 o'clock though, Professor. Do you have to go?
beg your pardon?
It's 1 o'clock.
I didn't hear you.
It's
said
1
1 o'clock.
p.m. if you have to go.
Oh, I do in a minute. I'll give them 5 more minutes and then I will go. Let me just do this one more with you. Okay. I don't know. I do this whole backspace thing and it didn't work for me. There we go. Okay, one more. Another dopamine one. And the reason I'm using dopamine is because this is what tends to come up a lot. Dopamine, 20 mils per hour. Concentration, again, is going to be 800 milligrams in 250 mils. Again, the weight it's going to be, and I'm making it straightforward for you, 70 kilograms. And again, we are looking for micrograms per kilogram per minute. All right, guys, see if you can do that one. What would be, so how would you present this first of all?
Really big.
You would do micrograms. Oops. This is what we're looking for. I always put that out there because it's so easy to start to think we're looking for mils per hour or something like that. I always start with what is it I'm looking for to help me keep my line straight on the top and on the bottom. Okay, so $800 milligrams in 250 mils. Is that what we want? No, we want micrograms, right? So we're going to put our milligram here. And our micrograms. We know that there's 1,000 micrograms in a milligram. We know that we've got another pair, 20 mils in 1 hour. Is that what we're looking for? No, we're looking for kilograms per minute. So we're going to get rid of that. 16 minutes in 70 kilograms. Now, obviously, if you've got pounds here, you have to convert it to kilograms. How many kilograms, how many, we do kilograms in a pound, right? I think. So what we have here? Anybody calculated out the top? Amber and Mimi always are letting me know. Somebody else, please. What would this top number be?
16,000. 16, I'm sorry, 16 million.
Yeah.
Yeah, 16 million.
And what would the bottom one be?
1,050,000.
Oops, I'm sorry, that's a 0. I apologize. You know what I mean, right?
Mm-hmm.
And then I tend to, if I can cancel things out, I do, because then it just makes it easier when I calculate. So what is the answer?
1.6.
No, you don't round up.
Oh gosh. Wait, hold on. I want to just keep on rounding.
Don't, yeah, not with dopamine, unless they tell you to round. With these ones, you tend not to round.
15.
15.
15.2, I think.
Right. Yes.
2.3.
15.2, yeah, micrograms per kilogram. I'm sorry. Actually, I've got pretty good at this, I think. All right. I would suggest in your dosage count books, pick out some of these over the next couple of days. You know, just pick out a couple of micrograms per kilogram per minute ones. Pick out a drops per minute one. And, you know, mils per hour is pretty straightforward. But remember, the mils per hour could be confusing in other ways. So what we're always trying to be aware of is, you know, we're looking at our milligrams, we're looking at what we really want. It's so easy when we're in an exam situation to not see these pieces, right? Very, very easy. All right, my dears, I am going to make this call. Let me meet back with you. Have you started on this afternoon's work, or do you need to still upload things for this morning? How are you doing?
You asking us as individuals?
Yeah. You're doing okay on this morning's work? Just need to
Already.
finish.
Yeah, I
Some of you have
uploaded.
already done it, and I've already graded. Those of you that have uploaded everything, I've already graded, right? I've already graded you. So the sooner you get it uploaded, the sooner I'll grade it.
And we just got to do a care plan, or is it a concept map for the second part?
I did put care plan and use the same care plan format that you used last week. With the two nursing diagnoses, and I think there was I want to say three interventions. I'm talking off the top of my head rather than looking at it, but the one that you used last week, use the same one.
But the paper, not the PowerPoint.
And you can do it however you want to do it, but what I'm asking is use the same format, meaning those pieces from it. If you want to do a slide, instead of it being on one piece of paper, if you'd rather, you know, take that column and make it into a slide, you can, if that's easier for you. For me, that would probably be easier. You know what I'm saying? Like each column.
Instead of writing on that little bitty piece of paper.
Yeah, or you can write it on a piece of paper, or you can type it on a piece of paper. You know, if you want to download it as a PDF and upload it as a Word doc, you can do it how you want to do it. I am not, as long as the information is there, that's the most important thing for me.
Okay.
But some people prefer to be creative and do fun things with it. So, you know, however you prefer to do it. I will meet you at 5. Contact me for any questions, any concerns. I hope your dad's okay. And
Thank you.
yeah, let us know. And I'll meet you back here at 5, if not sooner, if you need me to. All right. Was this helpful going over this a little bit?
Yes, ma'am.
Yeah. Okay. All right. See you in a little bit.
Yeah.